Sydney averted a COVID catastrophe, according to new modelling provided to the state government. It says without the lockdowns and extra Pfizer from Poland, Sydney's hotspots would now have more than 500,000 cases and thousands of deaths. Here's state political reporter Ashleigh Raper.
A day on from revealing that hospitals are likely to be overwhelmed by COVID patients, the Premier is back focusing on her opening agenda.
Coincidentally, the worst time in hospitalisation is likely to be the time that we open up, but that shouldn't stop us from proceeding.
Today, she allowed modelling to be released, outlining what could have been. It reveals that if there hadn't been a lockdown or extra Pfizer doses, there could have been more than 500,000 cases in the hotspots and close to 6,000 deaths. It suggests that the extra Pfizer from Poland prevented 24,000 cases and 254 deaths. But the Premier insists there's no government modelling for the number of deaths based on the current situation.
Well, certainly none that I've seen.
7 more people have died. 1,100 people are in hospital, 192 in intensive care, and there are 1,220 new cases. The state's health officer has been asked whether the curfew was working in hotspots after the Deputy Premier said it wasn't.
It's really important to know that the evidence for curfews is mixed because you can't tease out one thing.
But when standing next to the Premier, John Barilaro backed the policy.
Curfews play a role in compliance. Compliance was the issue that we were seeing that was problematic, and that's why the police and health put that forward.
The curfew will stay in place for now, while the government prepares to reopen the state. Next month, it plans to trial including vaccination status on the Service New South Wales app. It'll mean immunisation proof won't have to be shown separately.
The Medicare application is available now, but for convenience sake, New South Wales is developing our own product.
Until it's up and running, police will use the Medicare app for proof when new freedoms start next week. It's now mandatory for all police officers to be vaccinated, and they have until the end of the month to have had their first dose. Ashleigh Raper, ABC News, Sydney.
The Health Minister has fended off criticism about his visit to the state's far west in the middle of a COVID outbreak. Brad Hazzard has conceded that more should have been done to provide emergency accommodation for people with COVID in Wilcania.
Flying into Wilcania, Health Minister Brad Hazzard found himself here on the day the town recorded its 100th infection. Mr Hazzard met health staff before visiting the newly installed motorhomes for COVID patients and close contacts. He also dropped in on the Wilcannia food bank, which is still delivering thousands of packages a week.
I've made a decision which is to be on the ground and to hear what people's concerns are. It's already been extremely valuable.
But it wasn't all smiles. The Broken Hill Mayor says instead of a visit, she would have liked to have seen more resources provided like contact tracers.
At the moment, don't understand what the visit's about while we have so many resources that we need.
Look, I respect Daria, always have, but I think that as Health Minister, I wouldn't tell her how to be Mayor of Broken Hill.
For locals, it gave them a chance to have their say face to face.
It's a good thing that they're out here on the ground experiencing it for themselves, not, just being in office.
But for some in the community, a visit from a minister just creates more questions, particularly surrounding long-term COVID accommodation and fixing the issue of overcrowding.
We need more housing in our community, so hopefully long-term we can get to that.
It's not just about, more housing, it's about health, our people who's living in poor conditions, and how is he going to address it?
While the visit came on an unwelcome milestone, community members just want long-term guarantees. Bill Ormonde, ABC News, Wilcania.